Hello friends, welcome to another episode of Bone Doctor. In today's episode, I'm going to discuss about bed sores or pressure sores. What are bed sores? Whenever a patient or a person stays lying down in his or her bed in his home or hospital for long periods of time, for 1 or 2 days or months, particular areas of his body develop sores or ulcers, which causes lot of problem for the patient. Now, how does a pressure sore occur? Whenever a person lies down in a bed in a particular position and due to his disability or due to any fracture or due to various problems, the person cannot turn sides and he lies still in that position for days on end or months. Particular areas of his body, especially the sacral area, that is the buttocks, the place between the two buttocks, the heels, back of the head, the back, the shoulder blades, these are the area which is in constant contact with the bed. Due to constant pressure in these areas, the blood circulation of the skin of these areas are reduced, and this causes damage to the nerves and the overall the skin of that areas. In initial stages, only the skin is damaged, there is loss of sensation, but as days goes on, the whole skin in that area breaks down, leading to ulcers. Ultimately, that ulcers get infected, and that causes sepsis and a large infection in that particular area. So, bed sores are a cause of morbidity and mortality in bedridden patients. So, who are prone to bed sores? Patients who are who have to lie down or remain supine or in a particular position for long periods of time due to his medical or surgical illness. Persons who are suffering from incontinence, that is, he cannot understand when he is urinating or when he is passing his stools, because if he has no control over his urine and stools, it is quite common that he or she may soil that area around the perineum with stools and urine. That causes infection and soddening of the skin around the perineum, which leads to accelerated bed sore formation. Patients who have very poor nutrition, who are eating quite less due to his medical illness, these patients have very poor skin quality, and these patients' skin are very thin and they break down very fast, leading to bed sores. Blood supply is also an issue. Many patients have a very poor blood circulation and poor blood supply to skin. So patients who have very poor blood supply also are very prone to bed sores. Now, how does the bed sore develop? The stages of bed sores. In stage 1, the skin which is suffering from that pressure is red, it is tender, that means it is very painful to touch that area, and the skin is very hardened. The skin doesn't have that normal softness or that plumpy feeling. The skin shows signs of initial damage. In stage 2, the superficial skin is damaged, the deep skin is exposed, there are signs of blister formation, signs of superficial ulceration, which shows that the area has been damaged. In stage 3, the skin is completely worn out. The subcutaneous tissue, that is the layer which is just beneath the skin, is exposed. In stage 4, the subcutaneous tissue is also gone, the bones and the muscles are exposed. And in this stage, infection starts. That is, the ulcer gets infected and there may be signs of pus or infection in that sore, leading to bad smelling odor, foul smelling odor coming out from that sore. So this is how a pressure sore gradually develops in the body. Now, what are the steps which we can follow in such bedridden patients so that we may avoid a bed sore? First of all, that medically ill patient or surgically ill patient should be turned sides so that the pressure points changes from the buttocks to his sides. Ideally, every hour the patient should be turned. If it is not possible, then we can turn him every 2 to 3 hours so that a particular area is not damaged or bed sore doesn't start on a particular part of the body. The patient should be kept dry as much as possible. If a patient is urinating or passing stool, the caregiver should be alert and should wash it off immediately. If the patient remains wet for a long period of time, the skin in that area is damaged and the skin can lead to sores very easily. Air mattress is a way to prevent bed sores. In air mattress, the pressure of that body is equally distributed over a large part of the skin, so a particular part of the skin doesn't suffer from a severe amount of pressure, leading to less amount of probability of bed sores. We can apply various ointments and keep the area dry by various powders so that the sweat accumulated due to lying down for a long period in a particular position doesn't cause damage to the skin of the patient. How do we treat bed sores? If the bed sore is in the initial stage, we follow the stages as I have discussed previously. We follow the preventive measures, that is, we turn the patient, we use air mattress, we apply various antibiotic ointments, gels to that pressure area and try to keep that pressure off that pressure area by turning the patient to make him lie prone or make him lie sides so that the pressure area is relieved of the pressure. In initial stages, if it is in a stage 1 or stage 2, the bed sores heal quite easily just by relieving the pressure from that particular area. If it has advanced to stage 4, that is, if the bones and the muscles are infected, pus is coming out, then regular dressing is required. In rare cases, plastic surgery is required to cover up the sore. Why is bed sore so important to know, and why it is the most major cause of mortality and morbidity in patients who are supine for long periods of time? Bed sores invariably get infected, and infection in the bed sore spreads to various organs of the body, causing sepsis and very early morbidity and mortality of the patient. So bed sores, if it develops in any person, it should be taken care of very early, and effort should be to prevent it, because once it's developed, it is very hard to treat and to cure a bed sore. That's all for now. If you have found the video informative, please like and share it, and if you consider, please subscribe to my channel. So bye bye for now. Take care.